Yai iger tetutietab tililindo en Kass TV amu kimnatet naet.
Kongoi mising chitab Kalenjin eng tetuteni kimi ak Bancy Murima ne inendet ko daktari nebo Crystal Homecare Kenya. Anguni kingalale akobo ribsetab chi nemiani eng gaa anan home based healthcare. Kibendi kiboisie kutitab chumbek anan Kiingereza. Bancy,
Yes.
Are you understanding anything I'm saying?
No.
Yeah, I'm just saying like the conversation today about home-based healthcare services. Tunasema kwa Kalenjin ribsetab chi nimiani anka.
Give me a paper and pen. But I'll learn. The time I'm leaving this place, I'll have 2 sentences.
Yeah, you have to pick something,
Yes.
you know. And sometimes when you're having this medical conversation, it's when you're like, I need to go back to my grandma and learn this conversation a little bit more, you know.
Yeah.
Before the break, of course, we were looking at the deeper conversation on palliative care, which is part of life. We can't escape it for some of us here.
Yeah.
But I just wanted to understand how, with the adoption of home-based healthcare, how is it improving medical services, especially for those people who were had to be in the hospital, you know, that those cases where every other time you have to be in the hospital. How do home-based care help this kind of individuals?
All right. As we said, it is time saving. It is time is very expensive, so it is very time saving. It is also money saving. In this day and era, you don't want to really spend much, but you really want to get the best of everything. Of every coin you give, you want to get the best of it. So I think that's people are really adopting it. I told you we are moving an upward curve when it comes to adoption of home care. And I say, yeah, so far so good. Actually, good job, good job.
Yeah, for sure.
And after 10 years from now, we will be so different when it comes to home health. So it's not only happening in the US.
Yeah, that's the thing, right?
It's not
Some
only
of the
happening in
things
the
we talk
US.
and people at home are like, isn't it that?
Zamaju.
Yeah, but it's here.
Yes,
actually, and
it
it's
is,
really
it is,
helping.
it is.
And I think behind the scene, when you are talking about cases where parents have had to leave work just to come home and take care of the kids because this kid is always sick all the time.
Yes.
We even have elderly parents
Yes.
where you feel like, oh my goodness, I can't just leave this person alone, you know?
Yeah.
So that is where...
We are evolving from the points where at home we will have somebody, a caregiver, to even take care of your parents. But at this day and age, everybody is working. Everybody needs to go to school. So we don't have that primary caregiver who is a relative. So that's where we come in, where we provide you with a primary caregiver. And somebody is able to take care of your parents at home. Even if they're not so sick, that's why we also have elder care, by the way. That's why we have elder care. That my dad is not so sick, but my dad needs to be reminded to take the medicine. My dad is not sick, but he's diabetic, and his meals, if they're not well coordinated, we are going to get sick again. So that's why we have that primary caregiver situated in your home to manage them.
Yeah.
The other thing also, what was I saying? I forgot. Yes. So yes.
I'm also thinking about the issue of the time saved, you know, because someone who is sick, it's financially draining, yeah?
Yes.
So you leaving work and being at home at that time?
Yes. So yes, I was telling, parents. Parents resign for children, and that's quite inevitable. When we have, let's say your child has cerebral palsy, this is a child who needs frequent hospital visits. And since we're not in a system where we have everybody working from home, we'll have to now keep taking this patient, this baby to hospital. So you will have the mother even resigning for the reason of that, because you can't keep sending somebody. Maybe the child is too sick. Having a primary caregiver or a house girl to take them, that is not very seamless, because not the primary, it's not like the mother would have done it. So the employer also cannot give you that kind of freedom to support your family to that extent. So that's why you find now the gaps of home care, the gaps of that health there's a gap there. So that's where home health really fits in. Yeah,
for sure. And also there's something we barely speak about, but it's happening. The exhaustion that comes with a parent taking care of a sick person.
Yes. It is mentally draining, financially draining, and you can't really, it's blood. So you try to give your best, but in the long run, you even find yourself resenting even taking care of them. You'll find now you probably leave your child with your sister who is sick. I don't know why I'm using children, but yes, you'll find yourself leaving your sister with that child who is sick. Eventually, she'll be like, hey, I need also to have a life beyond this. So then the inconveniences, there are changes in the family. So it is mentally challenging. Yes, it is very draining.
Yeah, and I love the conversation. I think somewhere you talked about psychosocial support, where it's not only about the sick. Yes, we need to care about this person, but also the parent or the primary needs that support as well, and even conversation with, are we calling them psychosocial therapists?
Yes,
the conversation.
Counselors. Yes, they're called psychologists. Psychologists come there to support you when it gets to some extent. Now that's what I think even hospitals right now have psychologists to support everyone, supporting the patient and supporting the caregivers. Again, healthcare is a universal burden. The person who is hurt the most is the person who is closest to you. And it can also, you don't know what impact it can do to you. Not everybody is able to handle some things with a calm heart. Other people, it will be really even get into a depressive state. So yeah, we really need a lot of psychosocial support when it comes to home care, a lot. Because imagine if you're seeing your ailing dad in your house at home, and you're like, goodness, I have done everything for you, Dad. What haven't I done? So imagine you have to deal with that every day. You're even reporting to work, not even feeling so ready. How did I leave my dad at home? So those things actually happen in the whole world. Just that at the point where you feel it, it's when it affects you directly. But I think everybody is affected.
Yeah, and I think the comfort comes with knowing that you're leaving your person with somebody, a qualified person, you know, not just someone but they really don't understand the condition, right? I think that's a blessing, really, because most of us need that, right? I'm just wondering, this being a conversation that we are having now, especially here at Tililinda program, it's like a pioneering conversation we're having here. How is the adoption in terms of Kenya as an environment to adapting or accepting this part of healthcare services in the country? How has it been like?
The adoption of the home health?
The environment itself, when it comes to government support, when it comes to us as individuals accepting this as part of the healthcare services we require. How has it been like?
Actually, I feel so bad that even the national government insurance, called SHA, does not pay for home health. Sadly, it doesn't. But other private insurances actually do support home health, and that is very good. Because now you say you cannot use your card to, like, as long as within the umbrella of that insurance, you're allowed to use your card and pay for it. Usually you're treated, we will bill the insurance to pay the agency. But the government, I feel that's a very big gap, because I mean, you're paying for it. I feel like you can get something out of it as a government insurance, but unfortunately we don't really get that support. I actually feel sometimes we are found as competitors in hospital and not as complementers. But I think as the adoption, again, we are moving on an upward curve, and that's a good thing. So I think eventually we'll have the government probably coming in. I will actually want it to be introduced and adopted very well.
Yeah, I think you've introduced something that I thought will, you want to take it slowly, but the issue of financial aspect in terms of cards, and I think you brought it out really well. Just a quick, did NHIF used to cover it?
No.
Yeah, so this is a conversation that really needs to come into play.
Yeah, I don't know whether probably, I don't know whether it's the policies. I don't know whether it's the policies or the policy makers, but it has never been adopted. I hope it will someday. I'm actually praying that we get there, that somebody with, I have a card ya SHA in mashinani, kuja nidunge shindano, and I can actually bill SHA and it will actually pay me. Because that's a care provided, and actually providing the primary health care, which is part of the government things that they do for us. So at the point of primary health care, I feel like home care should be put from that point.
Are there areas in the country where home-based healthcare services is more adopted than others, or it's spread across?
To be honest, let's say urban. Urban areas, it's more adopted compared to rural. Again, when it comes to rural, you'll find the person who's actually reached out is somebody from the urban. But again, we are slowly getting there. I won't say home care is not being adopted in the rural areas, but it is more adopted in the urban areas.
Do you think it's more about awareness and also understanding of this critical issues?
Yes, awareness also plays a part. Finances play a part too. Also, you find that in the village, you'll also likely to get a primary caregiver than a person who is working in Nairobi. They're likely not to have that primary caregiver. So those are dynamics, but home health is adopted around the clock, but people who are likely to adopt it, it's somebody in the urban areas.
Let's talk digital a little bit in terms of accessing healthcare services. Is Crystal home-based care something that I can get on an app, on a website, or how do you go about accessing services on there? You
actually search online.
Okay.
If you Google, where can I find home care? You'll definitely find you definitely find Crystal there. That's how people come to us. The other thing also, we have referrals. And then for even patients with physios, doctors will be very key points of link, because like I do physio for my patient and then I'll come and do a review. You see, again, we are still adopting it to make it very symbiotic. That's what you say?
I know,
very symbiotic.
The only scientific word I know.
Very symbiotic, yes. So, there.
I think there are a few words you keep mentioning and we need to expand a little bit about it. When it comes to physiotherapy, physio, you mentioned it, What is it and how important is it to continue having the services?
All right. Physiotherapy is said out loud as physical therapy.
Okay.
Physical therapy comes to healing and moving on. Let's say you had a knee surgery. For some point you had to really take care of your knee to heal, but now your heel is no longer paining, but you need to walk again. So if it's going to teach you first to even move from point A to point B with crutches is a physiotherapist. That is going to teach you to leave those crutches and walk without them is a physiotherapist, okay? Then there's a difference between a physio and an occupational therapist. Occupational therapy is, let's say you've had your knee injured and your knee was I'm looking for that word. I don't want to use cuts, but you actually lost your leg. And now you have to even use a prosthetic to walk again. Whoever teaches you how to use that prosthetic to walk is called an occupational therapy. Because now occupational is like working. How do you work with the new changes in your body? Okay? I've lost my arm, so how will I use this arm to make sure that 100% I can achieve using this one hand? I am facing challenges with this side, so can I use this side and actually fulfill my basic needs? Again, healthcare feels draining when you cannot do the most basic thing. Actually, healthcare is not graded with degrees. It's not graded with how much you know. But when it comes to the primary point of healthcare, can I feed myself? Can I drink water? Can I go to the washroom by myself? That's where the basic of every health, and that's why you find when a parent feels that they cannot do that, they feel like the world has gotten to an end. And that's why you find them also them getting into depression even as patients.
And there's something about dignity where you have to rely on other people to do basic things.
Imagine.
Right?
Imagine when you have to like tell dad, I need to change your diapers. Will you even accept really? No. It even feels bad for a girl to do that to your own dad. But no, you see, imagine you have no other person. But you see, when you have a caregiver, a male caregiver who is able to change that for you, that feels so easy on dad, because first dad only interaction with them is professional interaction with them. So I think that's how it becomes very easy to embrace home health as a basic need, as a basic unit of that house.
I was having conversation with someone. I'm telling you, are going to break some of these words you've said. I was having a conversation with someone, and they say, we are cotuna diabetes. And I felt like, because this is a disease that we've had in the country for a while, people don't really understand the need that comes with handling this disease. And I was wondering, for someone who has diabetes, what are some of the services that they require, and how does home-based healthcare come in?
All right, let's take diabetes as an example. So let's say you've been diagnosed with diabetes today. First thing, being classified as a lifestyle diseases, there shall be a lot of lifestyle modifications you have to do to change, to make your sugars not go up or even go down. So do you change your diet? Yes, we change your diet. So you need to talk to a nutritionist. From Crystal's point of view, we have a nutritionist who can come to your home and be able to make a meal plan. Meal plans are not made as a standard. You cannot say this is specifically for you and it can be used by me. No. What can this person access in Kalenjin? And they're supposed to Mursik is all I know. Are they going to take Mursik? I don't know whether they'll take Mursik with ugali. And you see, people they think that this man in the village is Mursik, Manago, and ugali. So why are you telling them to take a whole set of kiwi fruits, strawberries, and berries? It doesn't really make sense. But if you go to that home with them, you're going to tell them, actually, since you can access ugali, instead of taking the white ugali, let's try the brown ugali. Okay? So you see, it's actually custom made to you. It's not used by, it cannot be shared. Actually, meal plans, there's no standard meal plan for anyone. It can only be custom made for you. Then you find somebody in the urban areas who will tell you, actually do keto. I only do keto diet. So do we arrange that menu to fit that diabetic patient? And then you also come to medicine. Some diabetes has level where we do insulin treatment. They are not also able to inject themselves every day. So how do we do it to administer insulin? We have a nurse come at home, do your sugars, give you your insulin shot for the day. If there is need, if there is no need, they also hold. Again, that's the reason why they are trained people, because they'll know this is not something I can give insulin. This is the person who can, probably this is a person who will need insulin right now. This is a person who will need to take to hospital right now. So all those things need. That's what you can do for a person with diabetes at home. Another thing you can also do for them is, right now we also have remote monitoring applications, mobile applications. We also have gadgets that are also fixed in your body, by the way, that can be sending random blood sugars to a healthcare provider, probably your doctor, and can give you even a log. Instead of you pricking yourself every day, it tells you today your sugar was 4, today your sugar was 14. And it's also, if it gives that log, you're able to get the treatment that is required for you. So that you see, that is managed also by a primary caregiver. So they'll be like, hey, by the way, yesterday your sugar was high. What did we do wrong that your sugar also fluctuated upwards? So I think there's a lot. So if I'm given a diabetic patient head to toe, I'll know what to do with them. There's lifestyle modifications. Do we need to exercise? Do we need to lose weight at this point? So what can we do to support that patient? Primary caregiver again comes again. Let's go for a walk. The doctor said we need to adopt 30 minutes of a brisk walk. Let's do it. Then you do it. And it's nicely written, which is actually, we come up with a routine plan. So you don't wake up and decide, today you're not going to walk. No, it's routinely said, walk for 30 minutes, take your medication at this time. This is what you're taking for breakfast. This is what you're going to take for lunch. Then you also know the triggers, because sometimes even the sugar will be triggered by stress, triggered by sugars by probably a change of meal. Maybe you're traveling and there's a whole set of new menus. Yes, so those are things that that nurse at home will be able to tell you, no, don't do this, let's do this.
I love that aspect in terms of when you're alone, you feel like, I can go a day or two without doing this. But when you have someone there to watch every step, then it becomes easier. And there's always something about following instruction when it comes to your health services.
Yes.
Yeah.
Again, this person is external. I'm going to take an example. If I tell my dad, do not do this, he's likely not to do it. But if I tell somebody who understands me from a point of, I am a medical practitioner, and they're the patient, they'll actually listen. I said, we don't eat it, we don't do it. They'll actually do it. So those things also really determine the person's healthcare.
I really love how our healthcare services is heading in terms of new ways and new technologies that are coming up to ensure that we can have as good health as we can possible. We're going to go take the last break before we come back and finish this conversation. When we come back with Bancy, we're going to look at the step-by-step aspects that you need to take when you need to access home-based healthcare. I don't know about you, but this is actually a new field for me, and I'm grateful for Bancy being here just to take us through this, so that by the end of the program, you know that there's other health services you can access if and when you need it. So don't go so far. We'll be back shortly.
Testai iger tetutietab tililindo en Kass TV amu kimnatet naet.